So the voice captured.
Oh,
Okay.
Yep, our voice is getting captured right now. Hold on.
don't cut Jerry. You've ever met Jerry? You don't want to cut Jerry. Yeah, I mean, it's interesting.
See it really move. Oh, there we go. Okay. Want to make sure it's moving up and down between my indicator. Okay, I think you're all set. We have the recording going with the microphone on.
Right.
And the presentation's out.
Through the slides, it's through.
Yeah, exactly. She can just basically hit this. Or I think up and down work as well.
Yep.
Okay.
Perfect. Okay.
Great.
Tremendous. Thank you so much.
Good.
Perfect.
Great.
All right. You take care. Take care. Yep. Great. Grab yourself a coffee. Go.
Okay. Yeah, I essentially drove off from my home. Yeah.
What do you want to do?
Yeah.
Okay. Yeah, we're all up there.
I just want to make sure. You know, they're really supposed to be. Yeah. Yeah. But it's also remember stuff. Get together and plan. Yeah, things that need to be adjusted after go.
Minutes. It's always the technical stuff that gets you going, right? Good. Do you, by any chance, we are planning to all the information for the winter. The two are the affecting climate change. Looking at perspectives and things that are actually making a difference. One, and food system. So it's a two-way thing. Kind of food system. Those function already affect. Written about to see if you know anything about it. You'd be really good.
She's doing sustainability, not really, but you know, she's read enough of it, and she's got a CRC in some systems. So I would ask her. Sorry, I see She's retiring. So, and her father just started. And we might know her trying to.
Or anybody in government. Because I don't even know how many at the federal provincial level.
So their mandate is to help the food industry, not And I want to be more confrontational.
Yeah.
Being advocates of capitalist and goods policies.
Yeah.
So, they're obviously working on it, but they're not really working on it from a more industry to transition more sustainability. How can we get the credits for layers for the living, as opposed to really be what we call public policy. Just,
Okay. Yeah.
that's, they definitely have that meaning.
Okay. Thank you. Okay. Welcome, everybody, to the first rounds of 2023. It's great to see everybody again in person. And for those of you who are on Zoom and joining us in that way, it's great to have you with us. If you're having technical problems on Zoom, it's going to be a challenge because I don't have any backup for that right now, but you should be set up and hearing us and seeing the slides. For anybody who doesn't know, these rounds are public health policy rounds. They happen about 8 times a year, open to the general community of academics and practitioners and policymakers in this field. And they also serve as part of the required course for students in the collaborative specialization in public health policy. If you're a student and you don't know about the collaborative specialization and you're interested, then look it up. We'd love to have you join us shortly. And a public service announcement from Kim, who's co-organizing the Public Health Policy Lunch and Learn session. Go ahead, Kim. Sorry, I'm looking at health. Where's Kim? There you are.
So we're talking about lunch and learn on Thursday, the 19th of next week. We should all be in comments in the QR code that we might put up at the end. But it's obviously that document is going to be talking about health promotion.
Yeah, and Suzanne's a great colleague and she knows a whole lot about this stuff. So I highly recommend it. Today we are really fortunate and really fortunate. I probably say that every time, but I just feel so fortunate. And Mary's been part of this undertaking from its very beginning. And is a mentor in this program. She sends her students to participate, and she's been actively involved. This is probably the 3rd rounds that you're giving, if my memory serves correctly. And you've been really supportive in some of the institutes that we've done as well. Mary is our keynote speaker today. I'm going to introduce her in a second. We have Annette Blaze. Where'd Annette go? Oh, there you are. Who is our trainee discussant. And for the first time ever, Rob Schwartz is going to serve as the faculty discussant. So this is a new role for me. The way we do it, a really established formula. Up to 35 minutes for you, Mary. If you need a little more, we'll be generous. Then 5 minutes each for Annette and for myself as discussants. You'll have a chance to respond to discussant remarks if you like. Otherwise, we just go to the field and do some Q&A and discussion. And on this topic, I can only imagine there's going to be a lot to say and a lot to learn. So I'm going to introduce both Mary and Annette. I'll say a word about myself, I guess, as well. I know it's a little weird, but I will. So Mary is a professor in the Department of Nutritional Sciences in the Faculty of Medicine at University of Toronto, and she leads a research group on food and nutritional policy for population health. So who could be better than to be here today with a name like that? Her research examines the nutritional quality of the Canadian food supply, food intake patterns, and consumer research on food choices related to obesity and to chronic disease. Mary was recently named a member of the Order of Canada. Congratulations.
She's not so recent anymore.
Oh, wow. She's served on several committees of the WHO and global coordinating mechanisms for non-communicable diseases. Importantly for this topic, and for us who are interested in public health policy, Mary knows how it works from the inside because she was, before she came to the U of T, the director of the Bureau of Nutritional Sciences at Health Canada. So she's been there on the inside, and I know that she is also consulted all the time by the Government of Canada and is heavily involved in nutritional policy changes that have occurred, and maybe those who haven't yet occurred, that she and many of us would like to see happening. So it's really great to have Mary with us. Annette Blaise, whose bio is up here, but the screen shut down in the meantime. I'll start by saying that Annette is a trainee with us in the collaborative specialization in public health policy. She is also a member of the planning committee for the institutes that we use. And the next institute, this is news for most of you, is going to be on the felt effects of climate change. And we're looking at food sustainability and climate change and food insecurity, and climate change and temperature change. So it's in planning. I'm seeing some nods, so glad about that. In addition to all that, Annette is a student in nutritional sciences. I think she's connected somehow with you in some way, shape, or form. She is part of the Feeding Kids, Nourishing Minds research team out of the Lawson Center for Child Nutrition. And specifically, her work focuses on evaluating the nutritional quality of school food programs with the goal of informing forthcoming federal policy. Go for it. Prior to starting her master's, Annette worked for the Employment and Social Development Branch of the federal government, so she also knows what it's like inside, where she developed a keen interest in public policy processes. Annette is particularly interested in nutrition policy as a tool to ultimately improve population health outcomes. Well, so we've got a great team. We'll not be about nutrition. Except what I've learned over the course of time in this collaborative specialization. But I do have a background in public health policy, as you may know. I'm a professor in the Carolina School of Public Health. I'm housed at IUPME and at the Social and Behavioral Health Sciences Division. Most of my research is about tobacco and cannabis. My only connection with there would be with edibles. So with that, over to you, Mary. Yeah, from up here.
Oh, thanks, Rob. Is the sound coming up okay? I hope it's coming up for the external people. Okay. And actually, Rob has got some nutrition training now by, I would say, through osmosis, because he served on a student committees for a number of my students along the way. So we think we've trained him quite a bit recently too. Okay, well, thanks very much for having me today. So I'm going to talk about the development, implementation, and evaluation of front of pack labeling. And it's really a policy implementation to improve health. And I'm talking about this one particularly why is, in case you didn't hear the news, last June, Canada passed its final regulatory package in Canada Gazette Part 2 to implement front of pack labeling, mandatory front of pack labeling in Canada. You won't see the labels, there'll be warning signs. You won't see them until January 1st, 2026, but the regs are there and it's happening. So I think this is a good timing to sort of say, and we've been working with Health Canada, providing evidence to them, doing research for now probably 10 years to see this to this spot. So why do we really care about healthy diets? And I don't know if you can read it, but the healthy diets is actually the first or the second, or unhealthy diet is actually the first or second most high risk factor for chronic disease. With males, it's tobacco. And if you actually look at, and you probably can't read them, but if you read some of the others, I can't read them on my small screen here. Half of the others in near that top half are also what I would call metabolic risk factors that are diet related. So hypertension, elevated blood lipids, elevated blood glucose. So you can see that not only unhealthy diets, but all the metabolic syndromes associated with unhealthy diets are also high risk factors for chronic diseases. And to put this in perspective, chronic diseases account for about 70% of the deaths worldwide. So when I worked at WHO with them for years and years, there was a big push in the early 2000s to get them to think about in the developing world, because they do a lot of their resources to the developing world, which was really focused on what I would call communicable diseases, you know, the traditional malarias and that. But the developing world is actually losing more of its population to chronic diseases, and they don't have dialysis machines, they don't have transplants. I mean, all of those things. You've got heart failure, all of those things. You're pretty well got a death sentence in most developing countries, and so they were losing their population at around 50 or who should be the most productive and contributing to society members. So it really is a big thing. And in Canada, it counts to about 88%. So we've got rid of a lot of the communicable diseases. So really the developed world, it's, but still we're talking 70 to 88% of disease deaths are due to NCDs. And actually, as of 2016, 3 out of 5 Canadians actually currently have an NCD that they're managing as a chronic condition. And as I mentioned, unhealthy diet, so there is factors. So this is what the front of pack, not the red bar, but this is what the front of pack labeling will look like that you'll be starting to see on foods. And what it really is actually a tool now. The government has come up with a whole slew of public health policies in recent years. We've got the healthy eating strategy introduced in 2016, but we've got regulations in 2018 that ban the use of trans fats, new nutrition labels, and restrict marketing to kids. All of those types of things. The warning labels are really help part of the implementation. If you're going to implement a lot of these foods, warning labels are going to be one of the most key things. And I will say, this is a kind of a disappointment, but Health Canada doesn't call it a warning label. They call it a front of pack symbol. But the science behind it is all the science of warning labels. But there was such industry opposition to the sort of stop sign approach that they went to this magnifying glass. But to the consumers, that still reads caution, look at it, and consumers will be trained to, look for those foods and avoid them is really what we want them to do. So what's happened in the last while is we've really moved public health policies in the food space from what I call the original ones were education. In other words, the whole onus was on the consumer to be responsible for their own food choices. And if you had obesity, chronic disease, it was your fault. You weren't following the food guide, you weren't reading labels. But in actual fact, we recognize this is the food environment. And if you don't have policies to improve the food environment, you really can't do a lot to enable consumers to eat healthily. And so we really have moved in the last 10 to 20 years in what I call regulations to help that. So most simple would be mandatory nutrition facts tables, which I introduced when I was in government. That was in the early 2000s. That was the first point of making it mandatory. Calorie labeling came out in some of the provinces. And so those are regulations that mandate the information. So you have information, but then you mandate the information. And then I would say the most important part now is what we call reformulation, where you really want to improve the food environment through regulations. And front of pack labeling is just one of those, but things like the trans fat ban. I mean, you cannot use trans fats in Canadian foods anymore. Period. Full stop. It's considered adulterated foods. Sodium, they were voluntary targets, quasi-effective, not very. But those are all policies to change that food environment. And so we really shifted the responsibility to all the onus on the consumer to look after themselves, to creating a food environment to help that consumer. So you don't have to think about it all the time. Your food choices are healthier to begin with. So what is front of pack labeling? So this is the definition from Codex. And if you don't know what Codex is, Codex Alimentarius is the authoritative body recognized in the World Trade Organization. If companies have trade disputes around foods, the standards, guidelines are not the regulations, but the guidelines, standards that countries have to be consistent with, or a country can bring a trade challenge against you. And it defines it. I think the important words I bolded was, has to be simplified. So we have the nutrition facts table in the back. People don't, half of them can't even understand it, can't read it, can't do the math, can't do percentages, don't know what should be higher, what should be lower. So it should be simplified nutrition information. On the front of pack, because we've got evidence, people don't turn food packages over in the store to look at the nutritional labels. And it can be in the form of either symbols, graphics, or some kind of text combined, but it has to be intuitively simple. The consumer can understand it without having to have a lot of nutrition information. And that's why these warning labels, you get it. People see those all the time. So that's what front of pack definition is. Now, there are different systems around the world, and I think you can look at them, and there's many ways of classifying it, but I think the simplest way of looking at it is nutrient focused, and warning labels are nutrient focused. In other words, you focus on some nutrients of public health concern, and then you indicate they're either high or low, and that's what you see either through the warning signs or, red, yellow, green, stop sign type things, or summaries. In other words, in summary indicators, the consumer doesn't know what's behind it. They just know how that food is rated. 1 star, 2, 3 stars, or, the keyhole in the Scandinavian countries, it has to be a certain positive nutritional quality to get the keyhole, but you don't know why or how, you don't know how much is in anything there. But those are the two sort of basic, or the check mark type symbols. Those are the two basic types of ones. They provide different information, but you can see that in all cases, consumer still has a key message of how healthy that food is from that symbol. So how does front of pack labeling working? Theoretically, you probably can't read this, but this is a nice graphic, and I'll go through some examples from the World Cancer Research Fund, and you can look on their website. They have a lot of information about food policies there, but it really occurs through two mechanisms, and they actually are complementary and actually synergistic. In other words, you get a bigger bump for your money than any one side. So through the product reformulation, and you can just think about it. There's a warning label on foods, and you're a food manufacturer, you're going to want to avoid those labels. And if you can reformulate your food to avoid it, that's one side of the way that it's going to happen. And the other side is obviously consumer purchase decisions. If they're simplified and they're such, consumers should recognize them, see them, and reduce their purchasing. So this is kind of a schematic. This actually comes from Barbara Lehman, who's actually a Nestle representative, but this was presented at a thing. But you can just sort of see, you're a food manufacturer, you look at what the standards are, how does your food fit? And then you'd want to know, well, is it a main food or a whole meal? Because, you know, obviously the standards are higher or lower if you're a whole meal versus a single food. How does it fit in? Like, is that a food group where it's a particularly important set of, you know, sodium is going to see in processed meats, for example, or you might see sugars in your beverage portfolio. So you want to know where it is in your portfolio. And then you start looking at, how can I adapt? What are my ingredients in that food? How can I adapt it? And then you might want to know something about, you know, which ones are you going to spend the most effort? Are they your biggest sales that are consumed the most? As food manufacturer, you probably will choose those foods first that are your biggest foods that you sell the most of. And of course, then you do your reformulation, you test it, you see what it looks like, and then you say, does it pass, fail? And obviously there are food reformulation, food technology issues avail, but that's the cycle that a food industry would go through when they're confronted with a front of pack labeling system. Because ultimately they want to avoid that front of pack system if it's a negative system, or they want to up the game if it's a positive system. So one way or the other, they've got to reformulate to meet that criteria. So how does it work with consumers? Well, if you look at the consumers, you can say, here, for example, a front of pack warning. So first of all, does it get their attention? We absolutely know it's on the front, it absolutely gets their attention as opposed to on the back. Do they understand it? And that's the principle around front of pack labeling. It has to be intuitively easy to understand, to comprehend. So you don't have to do any math like a % daily value. You just understand high, low, better or worse. And then with that, with front of pack warnings, it should have a symbol that connotates some kind of risk. In other words, that's why people use stop signs, the magnifying glass. And then that should translate into behavioral intentions. When I see that, I'm going to buy less of, I'm going to avoid that food. And that's the behavioral response. And obviously it's filtered by their, you know, social desirability, you know, their cultural habits. But, you know, basically that's the milieu that the consumer would operate in to make purchasing decisions. So this is a busy slide, but I just want to say what's happened with front of pack labeling. Chile is probably the poster child in front of pack labeling. They actually passed their law in 2012 announcing that they would have mandatory warning labels in Chile. And they did it in 3 phases. The first phase, they could actually, companies could just put stickers on the foods, and the criteria thresholds were quite high. And so then they had 3 phases, and each phase, the thresholds got more and more strict. And they did it so that by the time we came down to by 2018, they've got fairly comprehensive, fairly strict thresholds, and they're mandatory on their foods. And over the course of the time, a whole slew more countries have now introduced front of pack labeling. So this is a slide done by UNC Chapel Hill, and it's put together. These are the countries that have now adopted mandatory front of pack warning. The dark reds, they're already in place, and the pinks are, they've been passed, but they're in that implementation phase. So Canada would be a pink one. And you can see the various symbols. So most of them are warnings. Brazil copied Canada, used the sort of magnifying glass type things, but you can see Iran's got a color-coded. Israel had such a high high proportion of low literacy. So they had to use symbols for salt, sugar, and fats. And a lot of Europe is using a Nutri-Score system, which is they color coded from green to red. Singapore has adopted it mandatory. But if you look at the voluntary systems, you can see that many countries have adopted voluntary. The Scandinavia use the keyhole system. Much of Europe, UK is using a traffic light. Much of Europe is using that Nutri-Score system, which is the gradation of from green to red. And then you can see a variety of other symbols around the world that are being used. And Australia and New Zealand are using a blended system with both a star and then on the side, just telling you, but there's no gradation. You don't know whether those numbers particularly mean high or low. They do have the percentages, but they're not very easy to see. So that's the systems. That's where the world is right now. So you can see about 40 countries are now well on their way to front of pack labeling. So we have this huge global momentum of front of pack labeling. So question is, what's the evidence behind it? So this is a recent meta-analysis, it's 2 years old now, that actually looked at about 4 to 6 studies that actually been done. In most cases, they were simulation, because the implementation wasn't there. But would people avoid showing packages? We've done some of them there. And the ones that were most effective of decreasing purchasing were sugars and sodium. Saturated fats hasn't in many cases shown the significant differences, partly because they're not that high and there's so many foods naturally occurring with saturated fats. So there's a bit of noise in the saturated fats messaging, but definitely sugars and sodiums are coming loud and clear. Consumers are recognizing it, avoiding it. So I'm going to give you some other examples of things that happened. Here in Australia, New Zealand, they have that symbol. You can see at the top, your top right, my right, anyways, at the top, with a star system. And basically when they introduced it in 2013 to 2018, they actually saw a reduction of about 6.7% of calories in the foods with the products with health stars in that period. And they also saw, as you can see on the right-hand side, the nutrient levels, the number of foods that now carry health stars have gone down. So the energy went down, that's 6.7%, but fats went down, sugars went down, sodium went down. Protein actually went down a little bit, and the fiber went up. So you can see that, there was a response, some real positive changes in their food supply in response, even though it was a voluntary system of front of pack labeling. And you can see from that transition from 2014 to their data about 2020, you can see that more and more foods were now carrying the health star ratings. But unfortunately, I think this is the problem with these voluntary systems. If you look at the slide on the right, the foods with good health stars, in other words, 3, 4, 5 health stars, have got more than half of those foods are now carrying health stars. But the ones that are poor quality have nothing. So if you have half the food with no health star rating and very few of the ones with poor health star rating carrying health stars, really, it's not really having the impact because consumers aren't knowing about the unhealthy ones. They're either not ranked or they're not rated, but very few manufacturers are voluntarily telling consumers that my food has only got 1 out of 5 stars, which sort of makes sense. This is some data from Chile. So now they're the mandatory high in warning. So you can see here's 2 years of Chile. And so the first one is reduction in calories. The foods with front of pack warnings for calories went down from 81 to 61, so 20% fewer foods with calorie warning, and half the number of foods with sodium warnings or sugar warnings, sorry. And so it mainly occurred in this case, breakfast cereals. And if you can see where the relative changes were, I've given you some food data. So sugars in soft drinks went down, I think 60%. Sugars in other beverages went down even more, almost 80%, 90%, but sugars also went down in breakfast cereal. So you can see a whole range. So the impact you have in different food categories is different, but pretty darn significant. And these are the major sources of sugar in the diet. So we're really having an impact. But you can see sodium also went down significantly, both in cheeses and in processed meats. This is the sausages and that. So you can see, and those are big sources of sodium in those food categories. So you're also having the impact in the food categories. It's differentially, but it's in the primary food categories that are the major sources of those nutrients. And now there's been a lot of talk about sugar sweetened beverage taxes, and a number of countries did that. Mexico did it. Chile did it actually first with sugar sweetened beverage taxes. And they managed to decrease the sales of sugar sweetened beverages by 3.5% by bringing in a sales tax. But I think that really is, there's a lot of price flexibility. So if you have a low tax, you'll get a low impact. If you have a big tax, you'll get a bigger impact. But you can see very little impact on a low tax on sugar sweetened beverages. But when they brought in their front of pack warning labels, you can see the big decrease, a 23% decrease in sales of beverages. And you can also see why food industry have fought in many countries against front of pack labeling when they know sales are going down by that degree. But and you think that looks like the worst case, but I think the 4 slides on the other side are quite worthwhile noticing. So if I put the first one is the differences in nutrient content. So this is pre and post the introduction. So the ones the warnings went down by quite a lot, but you also had an increase. So some of it's compensated by you're still getting some of the sugar, some of the sodium, but lower levels and more food. So the foods with lower levels are going up and the ones with high levels are going down. So you do get some of a transition. So the total amount of sodium and sugars isn't completely going down by the amount of the high ones, because those high ones are either just being reformulated to be partly lower and you get some increase in those ones that are lower. So it's not a full offset, but you can see that overall you're getting that beneficial effect. And this is just a couple of other quick examples. This is what consumers say. And the first one on the left is from Peru, and 91% of consumers said they would avoid foods that had warning labels on, and they either would choose foods with fewer front of packs. Can you imagine foods could have 1, 2, or 3, in some cases 4, or they wouldn't buy foods with front of packs, or they'd buy less. So, I mean, you know, that's how people will address. So they won't avoid all of them, because sometimes that's on a food category, a dessert. They're going to buy anyways, but they'll buy less of it. And the other one just shows the differences of where those occurred. And the sales went down. Cookies, the cookie levels, sales of cookies went down with reds, went down by 29%. It was mostly sugars and fats and cookies. And carbonated drinks sales went down 5%, and it was the high sugars. So you can see the differences are slightly different in countries, but they're all getting that consistent effect of sales going down, consumers choosing less. So here's Mexico. That's one of the recent countries that have gone. This is actually a modeling study done by a study Dave Hammond did at University of Waterloo, where they actually had consumers, gave them money to purchase beverages and had choices of with and without warning labels, and it was junk food and beverages. And they saw how much they decreased, and they actually figured out, well, okay, they used that data that Dave's group saw of how much those sales went down. How did that translate to how much where the calories went down? And then modeled that in Mexico, because they would have front of pack warning on junk foods as well. And so what would that translate into with those calories, changing body weight? What would that change into obesity rates? And they predicted that obesity rates would go down in 5 years from anywhere from, basically 12 to 17%. And Mexico is one of the highest consumers of soft drinks in the world. So you can see that if they really do have those kinds of impacts, you can have some significant impacts on obesity. And of course, these are also new. We haven't actually seen these data yet in terms of real life, but that's what it's modeled as happening. So there are a number of, with this kind of evidence, it's been put together a number of reports now that actually recommend front of pack labeling. And, PAHO, the first one, that's the regional regional PAHO, WHO Office of Americas recommends front of pack labeling, has got all kinds of help for governments how to implement regulations to do it. There's recommendations from the World Heart Federation, from World Cancer Research, WHO, a number of bodies, and Codex has principles now built into the labeling standards on how to do and what are the principles of front of pack labeling for countries to follow in implementing front of pack labeling. And so one of the questions, well, which type is most effective? This is a meta-analysis. Unfortunately, you can see there aren't that many studies that have been done because it's pretty new, but it seems like the warnings are the most effective in terms of a meta-analysis, but compared to the stars, the traffic lights, and then the other systems. So The early evidence is looking that the warning labels are the most effective form of front of pack labeling for actually changing food purchasing, which is really what you want, food purchasing. That's the easiest measure of consumption, because you don't actually have to say what individual breakfast cereals did you go, but you can say which ones were sold the most or least. And I said earlier about front of pack labeling. Codex now has standards set up, and it really says, simplified, standardized, and all that. And you can see what standardized is actually a really important word. And this is the situation they have in Europe right now. And the EU, wherever possible, has harmonized regulations throughout the EU. They're a trading bloc, but you can see now they've now got a proposal it was published in 2020, that they want to have a harmonized mandatory system in Europe by the end of this. Well, they were aiming for the end of this year. It hasn't happened yet. They were in consultation mode. But you can see if you're a consumer and foods go back and forth across the continent, right now they're all voluntary systems. They're going to have to pick one of these systems mandatory. And you can see Italy is one of the ones that challenged a lot of our work in Codex and held up our work on WHO for sugars. They're the most aggressive. They're the home of Ferrero Rocher and many others who've been anti food. And you can see they have one that has the least effective. You do all the analysis of front of pack labeling, just all blues, doesn't tell consumers much of anything. So it's not a true interpretive front of pack labeling system, but you can see they're the ones that they're dealing with in Europe. I don't know where they'll end up, but they've kind of got a mess on their hands right now. But voluntary systems are different. But once you go to a mandatory system, they can't have 10 different mandatory systems in the EU and trade foods across borders. So I'm going to talk a little bit now about Canada. So Canada started mandatory. They announced it. There was pre-work done, but they announced it as part of the healthy eating strategy in 2016. So that then became official government policy of the Liberal government in 2016. 2017, they started stakeholder consultations. So we did a lot of analysis for them to tell them, which foods would have. We helped them model, what kind of impact they would have in their regulations. And so then by 2018, they came out with 4 possible options of what the front of pack label could look like in Canada. And during that consultation, the stop sign was just like food industry went apoplectic about the stop sign in Canada is probably the word to use. But at least they had 4 options. All of them were interpretive. All of them had that connotation of warning. I put this in NAFTA this was February 2018. Well, during 2018-19 was during the days of NAFTA. The US actually put in notices during the negotiations that any country in NAFTA, if they introduced front of pack labeling, they would consider it a trade challenge. So they tried very hard on behalf of the US food industry to take front of pack labeling off. That was in March of 2018. So afterwards, they tried. And so there was a lot of reports went back and forth of how it is a public health policy that would be effective. And thank heavens there was data out there from Chile to stop that one. But if there hadn't been researchers doing data, that's how these trade things could actually really usurp really good public health policy if researchers aren't doing the evidence behind them and getting that evidence out. So I wanted to put that in. So it didn't, I put it in gray because it didn't stop the pathway, but it could have. 2019, the food guide, and the food guide says reduce your intake of processed foods because they're high in sugar, sodium, and fats, consistent with the front of pack. And it probably would have said, avoid foods with front of pack warnings if the warnings were ready, but that's the intention there. And then July 2022, the final regulations were published in Canada Gazette. And so this is the one they settled on, was this a magnifying glass with the words high in, and then it can have either 1, 2, or 3 indications. So 1, 2, or 3, depending on it's high in any one of those 3 nutrients or 2 or 3 of them. And this is kind of what it would look like. And I've got a better picture, but there's, for example, a pizza, and it would be high in sodium and high in saturated fats. And that's what a package would look like. So that's what the policy and regulations. So now I'm going to say, what do the regulations actually look like? Like, how do they implement this front of pack warning in Canada? So they focused on 3 nutrients of public health concern. The evidence is these are the nutrients that Canadians consume too much of, above the DRIs, above WHO recommendations. So saturated fats, sodium, and sugars. They set thresholds. So if a food exceeds those thresholds, it will have to have a warning symbol or the symbol on it. And they set it at if you consume less than 30 grams in a serving, so that's 30 grams, that's like condiments, salad dressings, things like that. The threshold is 10%. So obviously you consume less, so proportionately wise, you get a lot. If you consume more than 30 grams, it would be, so that's a traditional meal, traditional food serving. If it has more than 15% of daily value, it would have to have a warning and a meal. So in other words, if you had a whole meal, you don't have to meet that 15% threshold. Almost all meals would eat that, but that would be like a third of your day's intake. So it's given 30% of the daily value. And if a meal exceeds that, or a food that's over 200 grams, because, you have to have a standard. Someone say, oh no, it's not a whole meal, it's just something you have on the side. So they used weights of foods to set the standards and thresholds. So that's what the regulations are. There are some exemptions. So they said like health related, so foods that have positive effects that are recommended in the food guide. So things like milks and fruits, vegetables, those are all exempted with no added additions to them. So if you make milk and then you make it chocolate milk or fruit flavored beverage, if you exceed the threshold for sugars, you have to have your warning on it. And technical exemptions, there already are foods exempted from front of pack, from regular nutrition labels. So those would still be exempted from front of pack labels. They're foods like, for example, raw meats, fruits and vegetables that aren't in packages are exempted. And some really small package sizes, but most of those aren't exempted. They just have alternate formats. And then some practical exemptions, which I sort of disagree with, but sorry. And that's things like honey, butter, table salt. And I think things like honey, there's a lot of misconceptions out there. People think honey's healthier than table syrup, sugar, some of the syrups. And I think they gave them a technical exemption, but I think that's, from a public health point of view, is a mistake. But who am I? I'm not writing the regs, but it was in our comments, but they didn't listen to me, So if you were like a food manufacturer, Jen actually worked on this and some people in my lab, but this is sort of how you would take a food and go through from a logic tree decision model. So you'd take your food and beverage. There's foods that are excluded that already have mandatory labeling requirements built into them. So things like infant formula, meal replacements, alcohol unfortunately is another poor exemption, doesn't have mandatory nutrition facts. It should, but we all know what happened in Yukon when they tried that. But anyways, so if they're exempted, they're on the side. And then you have those ones exempted from front of pack labeling, which I just mentioned. And then you've got the rest of the foods. And then you assess them whether they're under the thresholds, they have no front of pack, or if they're over the thresholds, they would carry a front of pack symbol. And that's how you do the decision tree of a food. And this is what they envision a thing would look like. So it has to be on the top, it has to be the front, and there can be no health claims, other claims in that top board part of the food. So out of Codex and World Health, there's a number of criteria what makes effective FOP regulations. So I'm just going to show how the Canadian government follows those and how these FOP regulations are designed to be consistent. And these are the things like questions that governments have to decide. And you can see them here, and I'll go through one at a time. So nutrient selection. So we've got rationale of why we picked those nutrients of public health concern. There was also some saying we should have positive symbols encouraging the consumption of nutrients that we don't necessarily have a lot of. Well, Canadians aren't short of protein in most cases. Fiber, we do have less. But the way Canadian regulations are written for food and drug regs, they're risk-based. They're criminal code risk-based. So it's hard to make a risk for a positive nutrient and force them to sort of label them as healthy. So from a regulatory point of view, it's not very easy to do in Canada. Similarly for calcium and vitamin D, but they've been added to the nutrition facts table. For example, potassium is now on the new nutrition facts table. So we've got a rationale why we've chosen those nutrients. And then, obviously, if you were a regulation developer, you can say, how would you do it? So you could do it like Chile did the warning labels. Israel did it by pictograph because they said such a high proportion had low literacy levels. Others have done it just color coding the nutrition facts table, not very effective, or, a variety of different symbols. But, that's, and then the Nutri-Score at the bottom. So you can see this is sort of how they applied it to their nutrients. And why are these nutrients of concern in Canada? These are actually the data of our intakes from CCHS, and you can see all of them exceed the thresholds of the upper levels of, and below the recommended, like quite a bit above the recommended, which is below that. But you can see we exceed all of them. The next one is reference value. So how do you calculate it? Do you calculate it per serving, per 1,000 calories, per 100 mil? I mean, governments regulate foods differently around the world. Well, Canada decided to go by serving. Really, why? Because we have our nutrition facts tables based on servings. And to help with this and the new nutrition labels, I don't know if you've seen it now, nutrition labels, nutrition facts table has a serving size. Up until January 1st, 2023, the manufacturer could decide what serving size they would use. Now, Health Canada, when they changed their nutrition labeling regulations in 2016, that's now in place as of this year, that serving size has been regulated. So you also don't get manufacturers who can say their serving size is 30 grams and somebody else 50 grams. They've all been standardized. So that also makes the front of pack labeling standardized with our nutrition facts table. You can see the percent daily value. You can easily say, oh, it's 18. You know, it'll have a warning label on it. I put consistency here because it's number 4, but you can see now we're building consistency. The food guide says to, process of prepared foods and beverages that contribute to excess sodium, free sugars, and saturated fats undermine healthy eating and should not be consumed regularly. So now we'll have the warning labels to help consumers actually follow that guide. And you can see the nutrition facts table. Now you've got all those percents. So this sugars here, example, 22%. It would have a warning for sugars. The other fact is design. And I want you, without looking at the right, on the left-hand side, or your left, yes, look at that picture of ready meals. This is a traffic light scenario, and we did some testing with that. How many of you would pick the first one to be the healthiest, and how many would pick the second as the healthiest? Yeah, exactly. I mean, that's the problem with traffic lights. It's not a binary decision. So, how do you weigh, 2 yellows versus a red, 2 greens versus 2 yellows? I mean, that's really hard to do. And the data from the UK said people just end up using it as counting reds. That's actually what they have. And then this is data from, I believe this was Peru, or Uruguay, maybe, I can't remember now, where they actually tested a whole pile of symbols, and the warnings actually still came up as the most effective. And they tested hands, stop signs, various things, warnings, black hands, red hands, you name it, were tested. And the most effective was the stop sign. And why is this important? I think the whole issue about design is that symbol has to be quick and easy. Consumers actually spend about less than 8 seconds in the store doing a food purchase decision. So you don't want to expend a lot of mental effort in making food purchase decisions. And so your front of pack labeling has to recognize that consumer decision-making process that goes on in grocery stores. And Beatrice, she was a pro student in this one. She did a lot of research did it with front of pack labels on juice things, comparing, with healthies, without, and how long people spend in making those decisions. And it is all fast decision making, not the nutrition facts table that requires cognitive effort. So the other question is design. So these are things that Health Canada did test, and you can look it up in their website under their consumer research. And for example, the first example, they really do understood it faster. So they timed how long it took them to decide which was the healthier food when it was in that top right corner, as opposed to on the bottom. You can see that's it. And the understood faster if it was bigger. So that's the second characteristic. They set a minimum size it has to be, and it's a proportion of the principal display panel. So a proportion of the size up in that top third of the package. And not to have anything else. The third thing is when you put something else in that top quarter space, it confuses the consumer because you end up with could have conflicting messages. So food industry can put other things on the food package, but it can't be up there at the top beside that warning system. So they built into a system in the regulations these other criteria so that we don't confuse consumers, and make, through design characteristics, make that decision making easier and quicker. And this is some more data done by Health Canada, and it just says that when there is no front of pack, no label things, people happen to choose a sugary flake product. But when they when they actually put the warning labels on that sugary product, the people would avoid it goes way up. So, I mean, you can see that people did make those changes in the purchases when it was just originally, or once they saw that warning on it. Now, there was I told you originally there was 4 potential front of pack symbols that they investigated, and those are the 4 there. When they actually did the time to make a decision, well, the time to make a decision for using a nutrition facts table is about 17 seconds, where you can see 11 to 17 seconds. There's no way consumers spend that amount of time. But all of the 4 different systems all only used about 2 seconds, 2 to 3 seconds to actually recognize and see it and interpret it. So you can see that it met that criteria. So there isn't a lot of difference, but the magnifying glass was still the quickest processing time for recognizing and seeing it. So this is some work that we've been doing for Health Canada, and Jen's been leading this, and she's had to do it twice because she did it once for the CG1 and then they changed their regs. So she's done it a second time for CG2. So it's not published yet. I'm sharing it and she said it's okay. But we said, what does our packaged food supply look like in Canada? And so as you can see, about 30% of foods would be below the thresholds for all 3 nutrients. About 36%, a third, would carry 1 warning. About 20% would carry 2. And only about 2% would actually have all 3. Not that many foods that have all 3. And that's just the nature of foods. Some of them, lots of combinations of 2, but very few foods are all. And about 10% are exempted. I told you about those exemptions. So about 10% of foods are exempted. So you can see, and this is sort of like where our energy is coming from, because that's just the number of foods, but actually by what people consume. This is the energy. And you can see that of the energy, about 15% of our energy comes from foods away from home. This is from CCHS. About 35% are from exempted foods, about 27% below the exemption, and about 25% of foods that already have warning labels on them that people are consuming. And then you can see by individual nutrients, you can see the proportions. So of the foods. So you can see saturated fats, for example, there's a lot of them exempted. And that's really a lot of the dairy products, the whole milks, the cheese, without any additions to them. So really, and if you look at that top bar across, about 16 to 40% of the foods would now carry a front of pack warning if the food manufacturers in the next 4 years don't reformulate their foods. So the last part I'm going to talk about is some of the health impacts of front of pack. And so I know I'm probably running out of time. So Carrie Emmerich was a previous student in this, and this is part of the evidence we used to help Health Canada make it. And she looked at all the foods in our current system. I told you the UK found out that people were just avoiding reds. So we just went through all the foods that consumers had reported in the CCHS and said how many of those foods would meet the UK red traffic light standard. And then we looked at our food label database and said, do we have a healthier alternative of the same food without a warning label or without a red label? If so, we'll substitute and assume the consumers chose the healthier food instead of the one with a warning, which is what they said. And you can see that under that traffic light scenario, from about 50% of the choices that exceeded the UK will go down to about 40%. Obviously, we couldn't find substitutes. And for beverages, it went down quite a bit, hardly any. There were lots of healthier beverages. And you can see also the proportions of, 1, 2, 3. But you can see that just there, and that's no reformulation. That's saying, is there a healthier alternative existing? And of course, there probably will be more healthier alternatives over the time. But what did that translate into? That translated into 5% lower in calories, 13% lower in total fats, 14% lower sat fats, and 6% lower sodium. And in this case, not much lower sugar, but we didn't have that many low sugar alternatives. It's primarily just in beverages. But you can see that there's significant reductions just by that simple replacement impact. So how would that translate, into health impact? Out of our lab, we also we used a simulation modeling to say, well, we know the risk between various nutrients and the risk of chronic diseases. So how many deaths would we save? So we would save about 11,000 deaths, and you can see the confidence intervals per year due to diet-related NCDs if those percentages if consumers ate those those healthier foods and less of those nutrients of public health concern. So if they avoided red traffic lights, that's the type of reductions we would get in chronic disease. And most of it is chronic is cardiovascular disease. The new front of pack, I'm saying stay tuned. Nadia is one of the students in this course, and she's just finishing up the modeling and actually looking what our Canadian front of pack labeling would translate into lives saved and or disease prevented. So I didn't give her results here. I'll let her share them. So that's the end of my thing. So I've got one slide here to say, pretty good. I mean, I really am happy. I mean, when you think about it, Canada is probably the first, what I would call large Western country that's now introduced mandatory front of pack labeling. And when we had the meetings, I was as an advisor for Health Canada, something like some of the food industry really were totally upset. And they said, like, there's no way. And they really didn't care what was going on in Latin America. They said it had no relevance to North America. And I think they fought really, really hard. You saw that in NAFTA example against getting a toehold into what I would call the Western big market processed foods. Well, we got there. But how could we improve it? I mean, it's not perfect. And I think there's room with policy always to go. Here's what happens for this frosted flakes in Chile. Tony the Tiger is gone because they use the front of pack. If it has a front of pack, you can't market it to kids. So Tony the Tiger had to go. So they really don't allow any of those health claims, any other nutrient, can't say excellent source of vitamins and minerals. You can't say good source of fat at the same time on these foods that have warnings. So they really are discouraging the consumption. Canada is going to allow those claims, but they'll be down at the bottom. So, you know, not ideal, but it's a start. So we should be restricting all of those foods with front of pack labels. Shouldn't be marketed to kids. There's no way they should be in schools. You know, I mean, you can just think of all these policy places. It should be incorporated now into all the standards for hospital foods, daycares, long-term care homes. I mean, we need to sort of really get this notion of you shouldn't be serving these foods. Any government-funded, publicly money-funded food programs should not be serving foods with front-of-pack warnings. And I'd say the restaurant sector. This is a big bugaboo, and I don't know if you saw CBC Marketplace. They couldn't get into my lab to do an interview with me because I wasn't here, but I was in Florida, so couldn't do an interview. But my bugaboo is with all this front-of-pack labeling, there's no reason why you couldn't have those symbol on restaurant foods. They're a huge portion of the calories we consume every day. There's no mandatory front-of-pack labeling. There's no even nutritional labeling. You couldn't do a traditional nutrition facts table on a restaurant, but you sure as heck could put that symbol on a restaurant menu boards. They're doing calories. This would even take up less and I think have more impact. So that's the end. So just in summary, I just think it's an effective public health policy. We're going to get both manufacturer-driven reformulation as well as changing consumer behavior. And it really has the impact to change the food supply, change Canadians' intakes, and we hope eventually reduce the number of chronic diseases. And obviously there'll be new work to see the effectiveness. We hope there aren't too many loopholes, but people will be watching closely. And I think we need to really, part of it is this, strengthen this multi-pronged approach. So, have it adapted into other policies so it becomes one of these elimination of almost all these other policies, whether it's school foods. Maybe we still want a sugar sweetened beverage tax. Yeah. So that's the end. There's a whole pile of students in my lab. Some of them have been through this program. Most of them have at one point or other. And this work's all been funded mostly by CIHR. So I want to thank them all. Thank you.
Sometimes things seem so clear and so obvious, and especially when you present it, it seems like a no-brainer. So I'm going to, I'll do my discussion remarks. This is my opportunity. I've been waiting a long time to do this because I always sit over there and other people talk. So just a few sort of relatively brief remarks from me. Our training program is really about the policy process, and you've mentioned a bunch of things about the policy process sort of in passing, and I wanted to dig a little bit deeper. So you've given strong indications that the industry is a major player, no kidding, and that they prevented some things from happening that you would have liked to see happen. I know that it's taken a long time. So, policy change is often a slow process, but 2016 to 2026 it seems to me, and I'm just curious to know what you think, particularly slow. And it seems like some of the evidence has come later in the game, but that there was not a little bit of evidence even at the beginning of the process. So to what extent, was this a delay tactic that the food industry, was playing? On the other side, what does the advocacy coalition look like? Like clearly Mary LeBay and your lab is a big part of the advocacy coalition on the other side, although you can also comment on this, to what extent do you manage to maintain credibility while pushing one particular perspective? Because we've had some discussion about that this year. But who else is there, right? So what does it look like? How active are groups in this? We always talk about apathy because one of our policy change theories, the punctuated equilibrium theory, says that we're mostly apathetic about most things all the time, even though we care. It's not that we don't care, like we all care. At least the people in this room all care about nutrition and what we're eating, what we're not eating. But who's actually knocked out of their apathy to try and push this agenda forward? Like, why is it taking so long? Those are my main questions. I do have, I'm not going to ask all of my questions. I am curious to know though, like why those jurisdictions that were early adopters, why them? Like it's not sort of the usual folks that you would think would necessarily be the early adopters, although maybe in the area of nutrition you would, I don't know. So just a word about like what happened there that caused those, really significant changes much earlier, at least than here. My final question is really about the system that Canada has adopted, which is not the best one, where the evidence seems pretty clear. Like, what's going on here? Is this just the food industry really, playing its cards? Is it that the other side wasn't strong enough? Is it that the government, had other reasons for not adopting what appears to be a more effective way of doing this? So those are my comments, my questions. Don't answer them now. We're going to turn to Annette, and Annette, if you'd come up here, that'd be great, and deliver your discussant remarks. And then Mary, if you'd like, you can comment.
All right.
I think you're probably just going to.
Yeah, that's okay. So I think a lot of what I'll be saying kind of echoes what Rob just said. But first of all, thank you so much for your presentation, Dr. LeBay. It was really interesting to hear about this from someone with such research and policy expertise to understand both sides of that. So as you discussed, front of pack labels can be a powerful tool to improve dietary intakes and ultimately the health outcomes through both consumer decision-making and product reformulation. And I happened to see Nadia's seminar in the fall, and for everyone here, the modeling that she presented and the modeling that your team has been able to develop is really fascinating. So stay tuned for that for sure. Anyway, these labels can provide accessible and easy to understand nutrition information to consumers, regardless of their nutrition literacy or constraints, whether it be time or ability to understand the nutrition facts table. So this got me thinking that front of pack labels really have the potential to work as a tool to address health disparities driven by social determinants of health. Having said that, I think the ideas that you brought up about how we can strengthen the regulations by harmonizing them, I think that's really key. So front of pack labels will be a big step forward, but there's always more we can do and more we can work towards. So from your talk, I had two main thoughts that came to mind. First of all, I just wanted to dig a little bit further into the nuance and a bit of the controversy surrounding front of pack labels and the different values that can be brought to light through that. So obviously, in shifting the responsibility from individuals to governments and ultimately industry, the more that responsibility is shifted, the more pushback we're going to have. So front of pack labeling being in that regulation sector, it's obviously not going to be a popular policy solution across the board. So it's not surprising, for example, that commercial manufacturers are opposed to front of pack labels, claiming that it demonizes certain products and will impose high costs to redesign and reprint packaging. So focusing a little bit on that cost piece, it seems pretty obvious that a lot of these costs are then going to be passed down to consumers. And right now, I think it's pretty safe to say that a lot of us, myself included, are feeling the very high costs of food. So how can the government manage these competing interests or competing values? So front of pack labels that are going to be really beneficial for health, but come at a high cost to manufacturers and then by proxy consumers. And has that even really been a federal responsibility or priority, or do the health benefits just kind of trump all of that in this conversation? So I would love to hear your insights on that. But more broadly, how can policymakers mitigate these potential challenges and balance these competing interests and values, especially as it pertains to public health policy? And the second question that came to mind as you were discussing the policy development process has to do with that. Although front of pack labeling is a relatively recent policy development in Canada, it's been discussed for years and has been implemented in many other countries, as you showed. So it's clearly not a new idea, but I was wondering whether you had any insight into what factors finally allowed front of pack labeling to reach agenda status. Was it research, advocacy, a combination of a few things? What facilitated that federal action finally in 2016? And more broadly, in your experience with the federal government and in research settings, what are the greatest barriers and facilitators to nutrition policy change? So front of pack labeling is a great example of the science aligning with the policy, but as we know, that's not always the case. And what do you think we can do to mitigate these potential barriers and ultimately promote positive policy change? So yeah, those are basically my thoughts, and thank you for a very insightful talk, and I look forward to hearing your remarks.
Okay.
If you have enough to chew on.
Yeah, those are great comments. And this is my list, my scribbles here. So I actually wrote them down. So I'm actually I'll just go through them in order and I'll just give my thoughts. Don't quote me on them and maybe we'll see but there were things. So Rob mentioned about the policy process and the time, like, 2016 to 2026. I will say two things on that. That actually is fairly fast. I was working on trans fats, and it was a big issue in the 80s and 90s. We're the first country in the world to get trans fats mandatory in the labels. That was 2002. So we were concerned about trans fats from the 80s and 90s. So it took us almost 20 years to get it on the label. And then I chaired the trans fat task force, and that went from 25, 26, and we recommended banning them in 26. I think my brain might be losing some of those actual dates, and they didn't ban them until 2026. So that was 10. So that took us, you can see that's a pretty long milestone. For nutritional labeling, they went to a voluntary system long before my time, early 80s. It took them 20 years to make it mandatory. So, we're actually fairly fast. We think that the regulations were passed CG1 in 2016. So that, was pretty announced then. So the pre-work was done and then got the final regulations out this year. So that's really, from 2018 to 2022, that's 4 years, not bad. And then 4 years implementation. Now that's one I think is overreach because the industry says, as both you and, both of you mentioned about the costs involved. Industry said, and that's what Health Canada used. So they amortize the costs, and they say if it's going to cost industry X million dollars, and of course they always cry wolf and make the West give them the data for the worst case scenario of how many food SKUs they have, how many food packages they'd have to relabel, and so they were crying, we can't do it. It's going to cost millions, just like this climate you're talking. Between 2018 and 2022, that was COVID, food costs. We actually did an analysis in the lab, and we have this food database called Food Label Information, and we've been collecting food since 2010. We actually looked at the foods between 2014 and 2017, because we didn't have our 2020 data ready, and said, how many food labels changed in that 4 years? And of that we took the first thing, so if they were there in 2014 and not in 2017, they're discontinued. That's about 35% of the food supply. How many were there in 2017 that weren't in 2014? They're newly introduced. That's about a third of the food supply. Of the about 60% that 25, 30%, but the 60% of the foods that are there both years, about more than half of them have already changed. Either the manufacturer changed the labels, manufacturer changed nutrition information. And when we went down, there was only 89% of the food supply in 4 years had actually changed by the manufacturer voluntarily with nothing to do with any government regulations. So we gave that to Health Canada to really minimize that data, saying, look, we haven't published it yet, but it's on the to-do list to say, that's the evidence to say it's not going to cost you millions and millions. You're doing it anyways for your own marketing reasons, whatever you want. You're introducing new products, you're continually discontinuing. So that, I think, addresses that slowness. So, but they did give them the 4 years. They had the post-COVID, and I think there was a lot of talk, and there was a lot of talk back and forth with the public health. Should we really fight that or not? And we just said, you know what, given COVID, we might look like bad guys, picking on with the food cost issues, driving food costs by millions and millions. We said, you know what, let's not fight it. Let's take the win and run with it. So that was a number of decisions. So that's the timeless. Rob asked about coalitions and who was working on it. There weren't that many. I would say we have to give big thanks to Heart and Stroke Foundation. They have a full-time policy advocate working in Ottawa. Manny Arango is his name, and it probably wouldn't happen without Manny banging, hitting the streets, whatever you want to call it, visiting members of parliament, visiting things.
Right. I'll just add, Manny is also the advocate for tobacco.
Yeah. So he's got
one person, right?
well, and alcohol labeling and ACD defibrillators and you name it, everything that he's their policy advocate. So it's not just yeah. Yeah, and healthcare capacity and you name it, it's Manny. But he's an N of one. But Manny did pull together researchers like me. I've mentioned Dave Hammond in Waterloo, others, there's a Nick Putman-Kent who's doing a lot of work with marketing to kids. We're kind of working a lot of these together. And whenever government would get a pushback from industry, he would be in touch with them when his calls, and he would call us up, say, have you got any data? And we'd send him data, and he would have us, we went to parliamentary committee, standing committee, health, things like that as witnesses. That's how it was done, but it was one person. Dietitians of Canada were pretty good. I wouldn't say they led it, but periodically along the way, they pulled people together. They organized a consultation, which was really good, of all the health professionals. So they got medical associations, they brought Diabetes Canada, they brought others together. So, they didn't have full-time advocacy on this file, but they signed letters and put their names on it. And I think that was another really important thing, that Manny managed to have a lot of these letters that we all signed to the ministers of health and the various departments in government, but he managed to get 30, 40, 50 signatures from academic researchers and virtually every health professional organization in the country. So, an N of one did all that, and tobacco and everything else. Why the early adopters and why? How did they do it? I actually met with her. Chile was an early adopter. At the time, the president, when they first started talking about it, was childhood obesity and their childhood strategy. And that was actually in about 2008. So that was, and Michelle Bachelet, who was the president of Chile, and she's a pediatrician. And she took it as she was the champion of that things. And then Ricardo Wawi was the head of INTA, which is their sort of like National Public Health, was originally a nutrition and Institute of Research. And so they weren't seeing as many, sort of childhood malnutritions, which was what it was started by years ago. And they really took all this front of pack labeling and all the healthy food policy as their mandate. So really you had a politician and you had a champion in the research public health space who really.
It's a great example of a politician as a policy interpreter.
Yeah. So she really led it. In Mexico, it was interesting because that was another example that did it really fast. So they did around the same time as Chile went with their front of pack labeling. They went with the Unilever check system, and then it kept getting watered down, the criterion watered down by industry, and the government caved and they went with a smart check, but almost every food could get their health check. So they lost on that. But what happened was then there was an Institute of Public Health in Cuernavaca outside Mexico that report, sort of a separate agency, but like government agency. And the researchers there said, we lost that battle, and they just went full blast and pulled all the health professionals, all the research, they did all kinds of evidence, and Bloomberg Philanthropies and the Robert Wood Johnson Foundation funded a lot of money that went to those countries to do that work. And IDRC from Canada funded a lot of the research. So a number of research funders poured money into those countries to get those evidence for it. So they had the commitment for the policy, so they funded it. So that's kind of how it got through. And then Mexico had some government changes in the way, so managed to facilitate it. So that's sort of, I think, the two examples of how it happened. Mexico was led by their public health people because they lost the first battle, and they said, we're going to win it the second time because the first was so weak and it was so bad. They were ashamed of what happened. And the other question was, there's excellent ones and we didn't get the best one, and why not? You know, I think it's just a reality of we're the first Western country that got it. And I would say, you know, it's pretty good. And maybe sometimes people say, don't let perfect be the impediment to being, to having introduction. I still think, I showed one slide. All of those symbols were pretty darn good. And we did research comparing warning labels, and we used the stop signs, the stars from Australia. Every single one of them, there were slight differences between them, but every single one of them are about 5 times better than just the nutrition facts table alone. So I would say you have small incremental gains amongst the different things, but huge gains between nothing. So I think that's why we all kind of came and said, you know what, we're not going to fight that one. There's evidence that red would have been better. There's evidence that, stop signs would have been better, but any symbol is hugely better than nothing. So that's where we decided we weren't going to die on that hill. And then the health disparities and inequity. That's an interesting question. And cost. Well, I think there was good evidence now, and we'll get that data out that they, I think there's other things going on with costs, and they better not dump it on front of pack labeling. And we'll make sure that evidence is out there about the number of changes that are voluntarily done by the food industry. So we'll have that. I mentioned Beatrice did some work on front of pack labeling. She did an interesting thing about literacy, because I think it really is true. We did juices with different health claims on them and front of packs. And the people with the lowest health literacy rated we did juices and, the tutti frutti beverages, and the sort of the crappy drinks, if I can call it that. Consumers with low health literacy really rated them all highly and didn't really distinguish much. They didn't have the ability to distinguish the differential between all these beverages, where some of them were quite healthy and some were relatively very poor, just sugar water, flavored colored sugar water. With the front of pack labeling, how they rated the foods went down, and they were able to get that distinction between the different healthiness. So it is absolutely shifting that, has that sort of equity built in of the lower health literacy. And in actual fact, people with highest health literacy really don't need front of pack labeling. Most of them can tell the difference between, a healthy food or a healthy beverage. We did it with beverages, healthy beverage versus less healthy beverages. They had a pretty good range between foods. So I think it does work that way. But I think the cost, one of the things we do in FLIP is we have cost. So, and we've been managing food prices since 2010. So I think that's one of the things we got our last CIHR grant was for policy impact on food pricing. So the statistics are very complicated on this because we've got a lot of other dynamics, but we will be able to see the difference of a food category between the ones that have reformulated, the ones that haven't, how those prices have changed versus the ones that don't. So I think we'll be able to analyze that with some very sophisticated statistics. So it's work in progress, but we've got the data. So hopefully we'll be able to answer that. There will be costs passed down to consumers, but it won't be front of pack labeling costs. It'll be just all the other things going on. And that's why we can track taking it apart by the foods and the food cost changes, but do it differential and differential. In other words, how a food changes over time, and the ones that have different healthy profiles and without labels, because we're going to have to do this difference in difference analysis. What factors allowed us to reach things? I think it was really probably the biggest thing was people like Heart and Stroke who really allowed this one to get forward, who I would say quarterbacked it. I'm not a full-time lobbyist, but he was on my speed. I'm sure I'm on his speed dial email. No matter what, I'd answer him and send him data. If I didn't have the data, people in my lab just ran analysis for them. And I think, and not just my lab, other labs did the same thing. And I think that's, if there was data needed, there was some of us that could pull it. And PAHO was a huge help facilitate. PAHO helped facilitate through these NGOs to fund the studies and work with the governments to make sure they set up researchers to collect the data as all these natural experiments were happening throughout Latin America. And I think PAHO deserves a great credit. The office in Washington really facilitated a lot. And we use FLIP to help those countries collect their food data, their new label data. We store here in U of T, we analyze it for them. We help them with that. So, I mean, but it's coordinated through PAHO, and I happen to chair their science advisory committee. So, but I don't have the money to fund it. IDRDC has funded it, and some of the big philanthropists in the US have funded it. And to be eligible for those big philanthropic donors, they had like Bloomberg and Gates and some of those ones, Robert Wood Johnson, they're only eligible to low and medium income countries. So they couldn't, I actually asked Bloomberg if he could send some money to us so we could fight the Canadian fight. And he said, unfortunately, their mandate will fund in US, the foreign countries have to be low and medium income countries. But I think that's another big factor, was those philanthropic donors who realize that these experiments going on in these countries will provide the evidence that governments would need in countries like Europe and in North America to make those policies go forward. Barriers and facilitators. Barriers were absolutely pushed back by industry, and I think there's a whole documentation going on around the world on what we call the commercial determinants of health and the tactics that the food industry are using, copying after the tobacco industry. And we did an analysis in our lab. See, I can't tell everything in one thing here, but we published it actually on the Marketing to Kids legislation, and we actually followed all the government when the healthy eating strategy did a phenomenal thing. They actually published on a database, openness and transparency, a phenomenal database of every single activity on the healthy eating strategy between government and anybody else. And every document that was there, what was discussed, copies are posted. And we analyzed that for Marketing to Kids and for the front of pack labeling. And 80 to 90% of the activities were by a food industry. And they reached virtually every department. Like Manny could only get to Health Canada and a few others. They went to every department. They went to trade, they went to industry, they went to transport, they went to you name it, they went everywhere. There's no way Heart and Stroke could go to everywhere or even tag us along to a few meetings. They also saw the highest. Manny never got into the Prime Minister's office. He never got into a couple others. They got into the PMO, they got into Privy Council. So it just says the food industry just has so much more lobbying capacity and money. And not only that, they say it multiple times. So you'll have the grocery manufacturers, and then you'll have Nestle, and then you'll have Unilever, and you'll have Maple Leaf, and they'll all trot out how many food, and then you have the advertising industry, and you have the packaging industry, and you have the soft drink industry, and you have, you name it, every one of them. So it's not just one industry going to see on this file, it's 40 who all say they're important, and they've pre-prepared their messaging, their take-home messages, and their evidence. So it is a big full court press. And in front of pack labeling, the US industry got involved big time. And when I was at meetings in the minister's office at Health Canada and at standing committees, and literally there would be it would be the person coming up from New Jersey, from their headquarters, supporting their Canadian person or their Washington office. So it wasn't just, and they actually got to the point I thought government was good. They actually only allowed the same number of people, so they could pull out, they could only find like 15 of us public health people and medical community people to attend. So they only allowed 15 industry people to sit at the table. But, so that's sort of what happened.
The real world of policy development.
Yeah.
It all sounds so familiar from my area.
we want to turn now to the folks here, and open it up for
I
questions.
guess I have a question.
Yeah.
So we've seen from the consumer side that, you know, they're not buying as much, or they're ready for the high sodium. But from the production end, like, has there been any developments in reducing like the amount of sodium kind of get the threshold, so they're not?
Well, with the sodium reduction strategy, which Health Canada set targets for, that was voluntary. We've seen less than 15% of the food industries actually reformulate their foods to get lower in sodium. So it doesn't have the impact that we think front of pack labeling will. And if you see the data from like Chile and Mexico and that, they're reformulating when they have to go to a front of pack. When it's a voluntary program, they're not doing much. They're doing a little bit. Yeah. So they're using, actually a lot of times they're just using less sodium. And when it's mandatory, you get all the tomato sauces will be less salty, as opposed to one company becoming, less.
Thank you. I think one of your questions environment and the doesn't also develop much about food nutrition. I just wanted to ask about NAFTA. So what exactly was it that made them not successful in disrupting the process, and has NAFTA been successful in the past in having disrupting that?
Okay, so well, now it's called UNSA, but anyway, or whatever you want to call it, depending where you come from. But they tried to put it in the agreements that if the countries couldn't put front of pack labeling, it would be considered an unjustified barrier to trade. Because American foods wouldn't want to have, they don't have front of pack labeling, so we'd be disadvantaging the US, so it'd be a barrier. It wasn't successful because there was enough public health evidence, because under Codex guidelines and that, if governments aren't consistent with Codex, because Codex wasn't implemented at that time, they have to have a public health justification for doing it, and there was lots of evidence of public health justification, so it failed, but they tried. And I mean, over the years, I used to be Canada's lead negotiator on the previous NAFTA that related just to food, just like a little small part of it. And I mean, Codex Canada, embarrassingly, was one of the signatures of a WTO challenge against Chile when they first put in their regulations, and then 10 years later they're doing it and they're on the receiving end. But that was upheld because all of us, like all kinds, the whole world helped Chile get the evidence to withstand that trade challenge. So I mean, that's now why it's in the Codex standards, so that now they recognize it is a legitimate labeling requirement. Yeah, it's interesting when food becomes a trade issue.
Let's go to this item. Yeah.
Sure. Thank you very much for the presentation. I also want to say that it's a bit of a congrats on the leader team work like long hard fought battle, and it's all the things you see like good public health measures come out even against industry push back, which is a kind of nice activity piece too. There's change possibly at the side. But the first piece to speak a bit about restaurant strategy, and it's like a conscious choice, it's like policy advocacy kind of like take the battle, or whether that's kind of push back regulation.
Two things. One, I think it's the interpretation of regulations. I know the head justice lawyer who used to be my lawyer on Health Canada, and he's blew up the thing, but still have a lot of proof about. Their view that they don't have the ability to regulate the food industry. The restaurant industry, they say that's provincial, but they're thinking that food sanitary inspection mode. And I argued with him, you've got a justification for the food supply, but nutritional labeling in front of pack, you can use the same justification. And I think in a way, it's almost governments are too chicken to do it. And I don't mean that the wrong way, but bite off one challenge at a time, get this instituted. And I think because provincial governments have already started the calorie labeling. Ontario has, BC has, and dropped it. US started with the calorie labeling by cities and then by states. And then eventually, when there's stuff all over the place and different, then the FDA took, and they mandate the calorie labeling federally. So they've already set that standard that there's federal to justify it. So I think it's just going to take some prodding in the. I keep saying we'll do the evidence. This was a healthy eating strategy 1. We'll have a healthy eating strategy 2, and hopefully it's a.
Yeah.
Yes,
There's nothing stopping the provinces from using it, though, doing it, if they choose, or cities or whatever too. That'll be a bottom-up policy evolution.
Indeed, and that's how a lot of these happen, but it is this, the current administration, what it means.
Not necessarily in a lot of provinces, actually, we don't have a lot of provinces with very progressive public health policies these days. I won't name. Yes.
yes, I think also, yes, congratulations. This, I took away from this that we're shift of individual to the food environment and how profound that is, and just in terms of the Canada Food Guide, something, you know, we're also working on the National Food Program, and so I'm wondering now, with this sort of little packaging, is there going to be, like, as a jumping point into the other policies, something with the grocery store environment itself? Because I'm wondering if you go into the environment and so many percentage of the items, you know, what's making the grocery store want to stock certain items versus others, ensure that there are those alternatives there, also inequities between different spaces like food swamps and deserts. I'm wondering if there's.
Yeah, I don't have a good answer for that. I mean, I'm part of leading a thing called Informers, which is a food policy network globally. And the food retail is one of the spaces that we have like monitoring. And you're absolutely right. There's real disparities and different, you know, types of retail, what stock in stores. But that's a hard one to regulate. And who's got jurisdiction on that? Like, everybody's taken a hands off on that space in terms of a regulatory space. I mean, they do it indirectly by the things like product pack labeling. I mean, Loblaws originally came up with those guiding stars. And we did some evaluations, some other research in the problem. It wasn't effective, but they didn't really educate. There was a lot of problems the way they implemented it. But there's nobody sort of regulating that space. And I'm not sure how they would do it.
Okay, we have time for one or two more. There are two. Go ahead.
Yeah, awesome. Thank you. Along the same lines, thank you for the presentation and great work. It's really cool to see something like this come through. One of the slides you showed had a lot of differences in terms of like reduction between age, gender, and social economic status. And one of the things that we were kind of discussing along the same lines of, you know, with food desert or food swamp is there's like very significant differences in income and education among people who might shop at the exact same retailing store, see the same products. And has your team really discussed or looked at like the potential health inequities that come from that policy that, although it's mandated at an industry level, the consumer reading it might really only benefit those who already come from, you know, a social or economic or education class that would internalize those messages?
I don't know the answer. In Chile, they actually brought it into schools, and it actually worked at, like, when they did their focus testing, mothers who said, you know, my kids are saying you can't buy that, you can't, you know, we're told at school, we can't bring them to school. So it doesn't, and it doesn't, that was like, went through all socioeconomic groups. I mean, that was so. Our CITR price grant, we are looking at that using, working with StatsCan and working at the food consumption baskets. And so then we have some information about the households. So we'll see how, you know, we can do that. That's a, you know, a longer term project. But yeah, absolutely, that's a really valid question, because you can have it, but if they're not buying the foods, yeah, and that's how you do the whole pricing. So we want to capture both pricing and what we purchase, because it's not just pricing, it's what we purchase. So
yeah, and I do see like at the structural level too, where like if it's all mandatory, we will see those reformulations, and that gives everyone a better chance at a healthier diet. But yeah, I just noticed that one of the lines for low SES seemed to have a different pattern. But
yeah.
Oh, thank you. I want to echo what Sharon was saying. Congratulations. It's really eye-opening and helpful to see the entire population. Yeah. I'm wondering whether, you know, any of the research on that was done on food labeling involved patients with eating disorders. And this might be speculation on my end, but we know from adding calories to menus really impacted people, that negatively impacted people's recovery. And I assume people should have like similar impact on patients with eating, especially restrictive eating, who might have, you know, have a higher calorie, higher sugar, higher trans fat, as a part of their recovery treatment plan. And yeah, I was wondering whether there can be like any like sensible sources of information explaining that we chose these because they're bad for X, Y, Z cases, but not in all cases, so that people don't just spiral down the hill.
I don't know. And I think, I mean, these regulations only got finalized this past summer. I mean, we've now got sort of the 3-4 year program, and I think that's when now, like, you know, things like Diabetes Canada, you know, Obesity Canada, many of those will start figuring out how do we incorporate that into our eating guidelines. Like just about every disease has an eating guidelines, you know, things. And I think that, you know, I don't know that much about disordered eatings, but, you know, how do they incorporate those messages in? You know, I'm sure that will take place, but it's not being done by government per se. They often facilitate those groups coming together. They often act as consultants to help them interpret the things, but they often leave that to the, you know, the disease organization to, and the health professionals working in those spaces to know, you know, their clientele the best.
Hey, this was a very impactful and impacted group, very dense, lots of information, lots of really interesting discussion about how the policy got made and what the challenges are. You know, the way that Manny Stroke worked with you and other researchers is just another example, a really good example of the role that researchers play in advocacy and moving policy forward in a good way. And, you didn't answer my question about do you feel that your credibility is sometimes questioned because you seem to be pushing one policy off?
You know, yes and no. Some people obviously think my credibility is crap, but no, because I think I've always based it on this is what the evidence tells me, and I sort of try to say it as I'm not pushing a political agenda. I'm pushing policy that needs to respond to evidence, and I think you kind of put it that way. And then I'm willing to be the person who speaks to what the evidence says. I don't know if it helps or not, but that's the way I do it in my mind.
Okay. So just a neutral announcement. I just sent some the sign-up sheet, so it's coming. Don't leave before you sign up. And I want to thank Annette. Thank you so much for stepping up to the plate and delivering really interesting and helpful discussion remarks. And Mary, that was incredible. Thank you. I always learn so much substantively from you, but also about policy making. So, and thank everybody. We'll be back again in a month. Social activist, commercial determinant of health. Maria Paris, who's on faculty here in both of the different halls. So thanks very much. Keep warm, keep dry, keep safe.
Hey, Rob, as far as timeline from evidence to policy, can you remind me, when was the Surgeon General's report on the health accidents about?
It's been 60 years.
I like to think that the policy space is
Yeah.
Thanks.
Okay.
Yes.
Hello?
Yes.
You got it? Okay, good. Okay, perfect. Wonderful. Okay, great. Yeah.
Hello, is there any possibility of asking a question online?
You waited too long to be the faculty discussing. So now you got a lot of catching up to do. I think I've been faculty discussing at least 3
Well,
times.
now that I see here, I know I can do
Check with me to see whether I can get down on a Friday. Yeah.
Where do you get those?
Yeah. Well, I'm going
Hello?
and I think it's one of the things that is kind of.
Hello?
In some ways, we're much more efficient when we don't have this commuting thing.
Hello?
It's